Artificial intelligence is making its way into your doctor's visit. It benefits not only you as the patient, but the physician as well. All it takes is clicking on an app.
Ambient listening is a really new technique where I can listen into the conversation we are having. Information that is shared back and forth is recorded with the patient's notification, and then it is processed and it is brought back as a summary that basically is in the voice of a clinician who would write a note.
How does this benefit the patient?
This gives me the opportunity to pay attention to you instead of paying attention to my fingers as I'm typing on the computer. The technology actually allows us to get closer in our relationship with our patients. But still, I know that in the background, the technology is listening for all those clinical pearls that the patient is telling me along the way that should be a part of their medical history. I go into a clinical app, I select the patient, I consent the patient, and then I basically just press the button and the rest happens behind the scenes. How can I help you today? What happens is that the listening agent picks up all the conversation, even if there are multiple people in the room, and then pulls that all into a synthesis, and it comes back as a note within 3 or 4 minutes.
What are some different ways that AI is being used in the clinic?
Another way that we are piloting using AI is in answering in-basket messages by helping to draft a response that can be used by the clinician. It's an effort to really kind of decrease the effort that it requires and to be able to manage the many questions that patients ask.
What do you see from here on out? You have technology in the clinical setting, taking care of the patient. What's next?
We expect pretty soon that this same technology can be used to tee up our orders or help with our billing just by us speaking. So if we were talking and I said, I think you're going to need a chest x-ray to rule out pneumonia, it can be listening in the background and start to pull it up ready for me. When I turn to the computer, all those things we've just discussed are now a part of the care plan.
So AI is nothing to really fear, but to embrace.
We always have to be careful and responsible, but I think what we're seeing is that it provides a lot of value.